Welcome back to Living 808. In honor of April Volunteer Appreciation Month, we're talking volunteer recruitment with the State Health Insurance Assistance Program. Candace Nakamoto, Hawaii SHIP Volunteer Coordinator, and volunteers Ted and John join us now with more. Aloha, you guys.
Hi.
Aloha.
Thank you so much for being with us today. And Candace, I'm excited to talk more about Hawaii SHIP, but for those who don't know, what exactly is it?
Hawaii SHIP is the State Health Insurance Assistance Program. We're a federally funded, volunteer-based program helping Hawaii residents with Medicare information and education. Hawaii SHIP is administered by the Hawaii Department of Health Executive Office on Aging, and our program provides free, local, unbiased Medicare counseling, and we do outreach events through presentations and fairs. And we've been in Hawaii since 1992, so over 30 years now.
Incredible. And Ted and John, you've now been volunteering for a bit as well. So what made you both want to volunteer?
Well, I'm a retired physician on Hawaii Island, and I noticed that many of my patients were not getting the medical care and prescriptions they needed because of high costs. So I volunteered in order to help make sure that they could get the most cost-effective health insurance with the best coverage possible so they could afford to get the care they need.
And what about for you, Dawn?
My story is after retiring, I did the retiree thing of travel, eating lunch out with my friends every day, doing projects around the house. But then after I exhausted all my avenues of amusement and occupation, I started to look around for something more. I knew I wanted to volunteer, but I didn't know what to volunteer for. A friend turned me on to SHIP. I only had a vague idea of what SHIP was, so I looked into it. And I thought, this sounds demanding, but intriguing. And turns out I was right. It was, and it still is.
That's great. And what is your current role there?
Well, I help callers choose the Medicare option that gives them the best healthcare coverage at the lowest cost, including helping them find the lowest out-of-pocket drug costs, since prescription costs can be so high. I also help them find out if they qualify for any financial help, either from private organizations or government, and ways to reduce the prescription costs.
Well, my current role with SHIP is as a volunteer counselor. I like dealing with people. I like talking to them. I like helping them and guiding them through the maze that's Medicare.
And let's talk about some of those experiences, because again, you have been volunteering for a bit. What would you say for each of you is your most memorable experience?
I've had 4 callers who each had a drug either not covered or poorly covered by insurance for very rare and serious diseases. Each of them were asked to pay over, you won't believe it, but it was over $100,000 for just one drug for a year. And obviously none of them could afford it. So through changes in insurance and special programs, they were able to lower their costs to a few $1,000s each. And fortunately, they could get the care that they needed.
That's incredible.
That was very memorable.
So Dawn, what was your most memorable experience?
Well, my answer is a bit more general than Ted's. My most memorable experiences with counseling involved listening to the clients to figure out what the issue or their problem actually is. And sometimes this is 80% of the problem. Many of these people have gone round and round with various entities and gotten nowhere. And sometimes by the time they get to SHIP, they are exhausted and desperate. I help them untangle and identify the problem, acquire the information they need, and then we craft a plan of action that can be executed. Their relief is palpable and they feel empowered. And that's the key phrase. They feel empowered. Their gratitude is the evidence that you can make a difference.
And that's probably so rewarding for you as well, to be able to help in such a big way. So why would you guys think, and I think it's pretty obvious, but why would you say someone would want to volunteer with Hawaii SHIP?
It's very important to be able to make a significant difference in someone's quality and length of life. And the patients who call SHIP are very generous with their thanks. I think the potential SHIP counselors would get a lot of satisfaction if they join this program.
And what about you, Dawn?
SHIP is a great volunteer opportunity. It will definitely keep your brain cells alive. It can seem daunting because of the complex and confusing nature of Medicare. But hey, if it wasn't, nobody would be calling us.
Right. Okay. And for those that do want to call, want to volunteer, what's the best way, Candace? How do we get in touch with you folks?
If someone is interested in volunteering, they can call our helpline at 808-586-7299, or they can visit our website at hawaiiship.org.
Perfect. And we'll have a link to your website on our website at kh12.com. But it's a great way to give back in such a meaningful way and to really help empower those in our community. Thanks so much for all you guys do. Thank you for volunteering. And of course, thank you for joining us today. Really appreciate it.
Thank you.
All right, so much more when Living 808 returns. Stay with us.